All right, so this time, in this section, we're going to talk about the elbow joint and the muscles that bend the elbow. We call this sometimes forearm flexion. I like to think of it as elbow flexion, but either term works. You'll see forearm flexion though. All right, so this diagram is not going to be on a test, but it does help for some people to sort of orient and understand how the muscles are organized on the arm. This is a cross section through the upper arm. So we can see the biceps brachii here after they fuse together into one muscle, the brachialis here, which is going to help with forearm flexion, and then the triceps brachii, the three heads back here. Okay, if that helps, great. If not, don't worry about it. But we're going to start with the biceps brachii. Okay, so the biceps brachii, this big muscle here, it's biceps because it has 2 points of origin. One is the supraglenoid tubercle and the other is the coracoid process. They have one origin, which is why it's considered one muscle. Make sure when you write this, you remember to include the S. It's not bicep, it's biceps. This is one muscle, the biceps brachii, okay? You have a biceps brachii on your right arm and a biceps brachii on your left arm. This is going to flex the elbow when the hand is supinated, okay? And when we do that, we can get, check that out, huh? Nice little, okay, it's not much, I know, but I've been working on this, so I'm proud of this, okay? Now a nice little bump where our biceps brachii is. I'm trying to get it so you can see it nicely. Okay, now watch what happens when I pronate my hand. Okay, ready? There's my bump. My bump went away. See that? Now I'm still trying to clench, but my bump is not as big there, is it? That's because the insertion of the biceps brachii is on the radial tuberosity. So when your hands are supinated, there's a straight path from the supraglenoid tubercle to the radial tuberosity. When you pronate your hands and the radius flops over the ulna, that path is no longer straight. It's a less efficient contraction of the muscle. So what it actually inserts in is a bicipital aponeurosis, which is a little different from the other aponeuroses we've met. It is a long, wide band of tendon, but it doesn't connect two parts of a muscle. Okay, but it's still considered an aponeurosis because wide band tendon. All right, now, the bicipital aponeurosis connects the distal end of the biceps brachii muscle to the radial tuberosity. So in this image, the hand is pronated. Okay, so you can see that that aponeurosis is going to go across this opening or this indentation called the cubital fossa. So that is the action of the biceps brachii. So how do you flex your elbow when your hand is pronated? Well, you need another muscle, okay? All right, so here are the two origins, the two heads of the biceps brachii, the long head and the short head. Yes, I know the muscle looks longer on the short head, but the whole thing is longer here because it goes all the way to the supraglenoid tubercle. Just trust me. Okay, here it is on a cadaver. Okay. All right, now the muscle that helps is the brachialis. Remember, brachii means arm. Okay, so this is a brachialis. And it's primarily mostly deep to the biceps brachii, and the main belly of this muscle is distal to where the biceps brachii is. So this is why I'm going to use my other arm because my arm's getting tired. Okay, so also this one's kind of weak. Okay, so when we flex the biceps brachii and the hand is supinated, what we're using is the biceps brachii. When we flex the elbow and the hand is pronated, what we're using is the brachialis. The biceps brachii can't contract efficiently. The brachialis can because it inserts on the ulna. And so that one now has a straight shot to the ulna. Okay? And so that's brachialis, biceps brachii. Biceps brachii, the main belly is more proximal. Brachialis, the main belly is more distal. Cool, right? All right, so here's the organization of those together. Here's the two heads of the biceps brachii, and you can see the main belly is a little closer to the shoulder than the brachialis. The brachialis doesn't start until halfway down the humerus, and then it inserts on the ulna, on the front of the ulna. And then this little muscle here, you should be able to figure that out based on its origin. It's the coracobrachialis. Yeah. Cool, right? Okay. Brachioradialis. Well, if we name muscles by origin and then insertion, you already know what this is and what it does. It goes from the brachii, which means humerus, to the radius. Have you noticed that muscle names end in either IS or US? Totally a thing. If you don't remember, if you're like completely blanking, try to figure out like, okay, what is it connecting? And then put IS or US on the end. You might be right. Okay, so the brachioradialis helps with elbow flexion, especially when either of the agonists, either the biceps brachii or the brachialis, when they've already started doing the contraction, then the brachioradialis can really efficiently help. It's located down here on the lateral side of the arm, more distally. The origin is the lateral supracondylar ridge. So remember, that's that ridge above the lateral epicondyle. And it inserts on the styloid process of the radius. So way down here at your wrist. Okay, so whereas the others are going sort of from up here to the proximal end of the radius, the brachioradialis is going from the distal humerus to the distal radius. All right, now arm extension. Elbow extension, our primary muscle is the triceps brachii. This is a three-headed muscle with 3 points of origin and 1 insertion. And the insertion is this big common tendon that inserts on the olecranon process. So essentially what this muscle is always trying to do is bring your elbow closer to your shoulder, which it can't do because you've got a humerus in the way. So when you extend the elbow, you're working that triceps brachii. So 3 heads, there's a long head, a lateral head, and a medial head. This does not match our naming convention, and this is one of the reasons that we all hate the triceps brachii. The others are that it's a pain to use and work out, but you know, this is one. Okay, so I don't actually care if you name the different heads of these muscles, okay? But what I do want you to recognize is the medial head, the third head, is deep to the other 2, and they all insert on this really big tendon. So when you're looking at diagrams and models, like it's actually really, I know you don't think it is, but trust me that it's really easy to sort of lose track of where you are and think you're looking at the front of the arm when you're looking at the back. Okay, look for this big tendon. That's your triceps muscle. Okay, remember triceps brachii, always remember the S, okay? So look for that big tendon. That's your clue that you're looking at the back of the arm. That's your extensor. Then you can orient yourself from there, okay? One other little tiny muscle is this little anconeus. Isn't it adorable? It goes from the olecranon to the medial epicondyle of, or the lateral epicondyle of the humerus. And it's a little synergist to the triceps brachii. Like, I can help too. Like, triceps is like, I straighten the arm. And Conius is like, I can help. It doesn't do much. All right, so when you look at these muscles, okay, and when you look at a real person, and you are gonna start looking at people differently now that you're starting to learn the muscles. If somebody has a really good, well-developed triceps muscle, this tendon is actually going to make an indentation on the back of their arm. All right, so all of the other things we have are arms like down like this. So I wanted to include this diagram so you can see this orientation of the muscles from a different point of view. So here's the trapezius. Okay, there's the spine of the scapula and the acromial process. The deltoid, okay, does have 3 sections, anterior, acromial, and posterior portions. Biceps brachii here. Brachialis, remember, mostly distal and mostly covered up by the biceps brachii, especially from this angle, okay? And then triceps brachii here. So when you're looking from here, right? What you're seeing is partly triceps back here and biceps up here, okay? You don't work on your triceps, then when you get to be my age, you have bingo wings, so that when you go play bingo, you can say bingo and your bingo wings fly. Okay. Honestly though, look, I've been working on those. They're still pretty smushy. So then we have the brachioradialis. The main part of it is along the radius. And then we have one more muscle, ECRL. Okay. We're going to start getting into the muscles of the lower arm, and they're going to make you crazy. Really crazy. Okay. Most of them are named for what they do and what they do it to. And then if they need any other adjective, if there's like two muscles that do the same thing, they're going to have some sort of adjective. That's what this is going on here. E, extensor. Okay, what can we extend in the arm that starts with a C? How about carpals? Extensor, carpi, because adjective form. R, where are we on the arm? Radialis. L, this is our adjective because we have two of these muscles, longus. The opposite of longus is brevis, as in brevity, as in short. Okay, so longus brevis, we have two of these muscles. Now remember, we don't stick words on anatomic terms if we don't need them. So if we have an extensor, carpi, radialis longus, we're going to have a flexor as well. If we have carpi radialis muscles, we're going to have carpi ulnaris, aren't we? So in the next section, we're going to talk about the forearm muscles. Don't flip out. Stick. They're not that bad. Okay, they are that bad, but you can do it. All right, so here's our arm. This is the anterior side. Here's the subscapularis. Yeah. Okay, here's our teres major. Here's our supraspinatus. A little bit of the subclavius. Okay. Here's our coracobrachialis right there. Really thin muscle. Yeah. This one, two parts, biceps brachii. This bit back here is part of the triceps brachii. And then here, poking out under the biceps brachii is the brachialis. Okay. Here's the back, supraspinatus, infraspinatus, teres minor. And then this is the triceps brachii. And this is the brachialis. Okay. And then right here, that is the brachioradialis, and then this one's the extensor carpi radialis longus, which you don't actually have to. And this is just sort of more of a more posterior view, so you can see these a little more clearly. Infraspinatus, teres minor, teres major, and then all of this is triceps brachii with this big old tendon there. Good? Okay. Stay tuned for forearm muscles.